Have you ever looked at old photos of yourself and noticed how much whiter your smile used to be? You're not imagining things. Your teeth really are getting yellower, and it's happening to almost everyone as they age. But here's the thing most people don't understand. It's not just about the coffee you drink or the fact that you're not brushing enough. The real reason your teeth turn yellow with age is far more complex and, honestly, kind of fascinating. Let's start with a truth that might surprise you. Your teeth aren't actually supposed to be bright white. That Hollywood smile you see on TV? That's not natural. Healthy teeth have always had a slightly off-white or cream color, and that's completely normal. But what we're talking about today is different. We're talking about that progressive yellowing that happens over decades, the kind that makes you hesitate before smiling in photos. To understand why this happens, we need to talk about what your teeth are actually made of. Think of your tooth like a hard-boiled egg. On the outside, you have the shell, which in your tooth is called enamel. This is the hardest substance in your entire body, even harder than bone. It's translucent, meaning light can pass through it, and when your teeth are young, this enamel is thick and strong. Underneath the enamel is something called dentin. This is the yolk of our egg metaphor. And here's the key detail. Dentin is naturally yellow. Not white, not cream, but yellow. When you're young, your enamel is thick enough that it masks most of that yellow dentin underneath. The light reflects off that thick enamel layer, and your teeth look white or off-white. But here's where age comes into play. Every single day, your enamel is under attack. Every time you eat something acidic, every time you brush your teeth, every time you chew, you're creating microscopic wear on that enamel surface. We're talking about changes so small you'd need a microscope to see them. But over years and decades, this adds up. As you age, your enamel gets thinner. It's not falling off in chunks or anything dramatic like that. It's eroding at a rate so slow you'd never notice it day to day. But by the time you're 40, 50, or 60 years old, you've lost enough enamel that the yellow dentin underneath starts showing through more prominently. It's like wearing away the white paint on a wall until the yellow primer underneath becomes visible. The yellow was always there, you're just seeing more of it now. But enamel thinning isn't the only thing happening. Your dentin itself is changing too. As you age, your body continues to produce dentin throughout your life. New layers of dentin form on the inside of your tooth, and with each passing year, this dentin becomes more concentrated and darker in color. So not only is the enamel getting thinner, revealing more dentin, but that dentin itself is becoming more yellow. It's a double effect that compounds over time. Now let's talk about staining because yes, external factors do play a role, just not the role most people think. When you drink coffee, tea, red wine, or eat foods with strong pigments, these substances contain compounds called chromogens. These are intensely pigmented molecules that love to latch onto tooth enamel. But here's the crucial detail. They don't just sit on the surface. As your enamel develops microscopic cracks and pores with age, these staining compounds can penetrate deeper into the tooth structure. Think of young enamel like a smooth, polished marble countertop. Spill coffee on it, wipe it off, and it's fine. But older enamel is more like a worn cutting board with tiny grooves and scratches. Those stains get into the crevices and become much harder to remove. This is why the same cup of coffee that barely affected your smile at 25 seems to stain your teeth much more noticeably at 55. Your enamel has simply become more porous and receptive to staining. Smoking and tobacco use accelerate this process dramatically. Nicotine and tar don't just stain the surface, they penetrate into those microscopic cracks in aging enamel and create deep, stubborn stains that are incredibly difficult to remove. If you're a smoker wondering why your teeth seem to yellow faster than your non-smoking friends, this is why. You're adding powerful staining agents to enamel that's already becoming more vulnerable with age. There's also something called the diet effect that accumulates over a lifetime. Every acidic food or drink you consume temporarily softens your enamel through a process called demineralization. Citrus fruits, sodas, energy drinks, even sparkling water with lemon. Your saliva naturally remineralizes your teeth afterward, but if you're consuming acidic things frequently throughout the day, your enamel never gets a chance to fully recover. Over decades, this constant cycle of demineralization can contribute to enamel erosion and increased yellowing. Certain medications can cause tooth discoloration as well, and the longer you take them, the more pronounced the effect. Antihistamines, blood pressure medications, and antipsychotic drugs can all reduce saliva production, which means your teeth aren't getting their natural cleaning and remineralization that saliva provides. Tetracycline antibiotics, if taken during tooth development or in high amounts over time, can cause deep intrinsic staining that's almost impossible to remove. Here's something most people never consider. The way you brush your teeth might actually be contributing to yellowing. If you brush too aggressively or use a hard-bristled toothbrush, you're literally scrubbing away your enamel faster than natural wear would remove it. It's like using steel wool on a non-stick pan. Sure, it gets things clean, but you're destroying the protective coating in the process. Many people brush harder as they get older, thinking they need to scrub away the yellowing, but they're actually making the problem worse by removing more enamel and exposing more yellow dentin. Grinding your teeth at night, something called bruxism, is another major contributor that increases with age and stress. Every time you grind your teeth together, you're wearing down enamel. People who grind their teeth can wear away significant amounts of enamel over years, leading to noticeably yellower teeth and even shortened teeth. Many people don't even realize they're doing it because it happens while they're asleep. Now, let's shift gears and talk about what you can actually do about this. Because while some yellowing with age is inevitable, there are definitely ways to slow the process down and even reverse some of the discoloration you're already experiencing. First and foremost, you need to protect the enamel you still have. This is your #1 priority. Once enamel is gone, it's gone forever. Your body cannot regenerate it. So switch to a soft bristled toothbrush immediately if you haven't already. Use gentle, circular motions rather than aggressive back-and-forth scrubbing. You're trying to clean your teeth, not sand them down. Electric toothbrushes with pressure sensors can be excellent for this because they alert you when you're brushing too hard. Use a toothpaste that's designed to strengthen enamel. Look for one with fluoride, which helps remineralize your teeth and make them more resistant to acid attacks. Some toothpastes now contain hydroxyapatite, which is actually a building block of enamel and can help repair microscopic damage. Avoid charcoal toothpastes despite their popularity. They're highly abrasive and can actually accelerate enamel wear, making your yellowing problem worse in the long run. Timing matters when it comes to brushing. If you've just eaten or drunk something acidic, wait at least 30 minutes before brushing. I know this sounds counterintuitive, but here's why it matters. Acid temporarily softens your enamel, and if you brush immediately afterward, you're scrubbing away softened enamel. Rinse your mouth with water after consuming acidic foods or drinks, then wait before brushing. Your saliva needs time to neutralize the acid and begin the remineralization process. Drinking through a straw is one of the simplest tricks to reduce staining from beverages like coffee, tea, and red wine. The straw directs the liquid past your front teeth, minimizing contact with the enamel that's most visible when you smile. It might feel a bit odd drinking your morning coffee through a straw at first, but it genuinely helps reduce staining over time. Staying hydrated is more important for your teeth than most people realize. Saliva is your mouth's natural defense system. It washes away food particles, neutralizes acids, and provides minerals that help rebuild enamel. When you're dehydrated, you produce less saliva, which means your teeth are more vulnerable to staining and erosion. Aim for at least 8 glasses of water a day, and consider drinking water between sips of staining beverages to help rinse away pigments before they set. If you grind your teeth at night, talk to your dentist about a night guard. These custom-fitted mouthpieces protect your teeth from the damage of grinding and can preserve your enamel for years longer than it would otherwise last. Yes, they take some getting used to, but the protection they provide is invaluable. Many people report that once they start using a night guard, they wish they'd done it years earlier. Now, let's talk about whitening options, because there are more choices than ever before, but they're not all created equal. Over-the-counter whitening strips can be effective for surface stains and mild yellowing. They typically contain hydrogen peroxide or carbamide peroxide, which breaks down stain molecules. For best results, use them consistently according to the package directions, usually for a couple of weeks. Don't overuse them, though, as excessive whitening can damage enamel and increase tooth sensitivity. Whitening toothpastes work differently. They don't actually change the color of your teeth, but they do remove surface stains through mild abrasives and chemical agents. They can help maintain whiteness after a professional whitening treatment, but they won't dramatically lighten teeth that are yellow from aging. Think of them as maintenance tools rather than transformation tools. For more significant yellowing, professional whitening from your dentist is going to give you the most dramatic and safest results. Dentists use stronger concentrations of whitening agents than over-the-counter products, and they can customize the treatment to your specific needs. They'll also protect your gums and ensure even application, which prevents the splotchy results some people get from at-home treatments. Professional whitening can typically lighten teeth by several shades in just 1 or 2 appointments. There's also an option called internal bleaching for teeth that have darkened from the inside out, perhaps due to trauma or certain medications. This is a procedure where the dentist applies whitening agent inside the tooth itself. It's more invasive but can be remarkably effective for teeth that don't respond to traditional external whitening. For teeth that are severely discolored or where enamel loss is significant, veneers or bonding might be the most effective solution. Veneers are thin shells of porcelain that cover the front surface of your teeth, giving you a completely new smile. They're more expensive and irreversible because some enamel has to be removed to place them, but they can last for many years and provide a dramatic transformation. Bonding is a less invasive option where tooth-colored resin is applied to teeth to mask discoloration. Diet changes can make a real difference too. Crunchy fruits and vegetables like apples, carrots, and celery act like natural toothbrushes, scrubbing away surface stains as you chew. They also stimulate saliva production, which helps protect your enamel. Dairy products like cheese and yogurt are rich in calcium and phosphates, which help strengthen enamel and can even help rebuild it to some degree. Consider reducing your consumption of the biggest staining culprits. I'm not saying you have to give up coffee or red wine entirely, but being mindful of how much you consume and how often can slow down staining significantly. If you do indulge, rinse with water afterward or even chew sugar-free gum to increase saliva flow and help wash away staining compounds before they penetrate your enamel. Regular dental cleanings every 6 months are crucial as you age. Professional cleanings remove tartar and surface stains that regular brushing can't touch. Your dental hygienist can also catch early signs of enamel erosion and provide personalized advice for your specific situation. These cleanings become even more important as you get older because they help maintain what enamel you have left. Here's a realistic perspective to end on. Some degree of tooth yellowing with age is completely natural and honestly inevitable for most people. Your teeth are going to look different at 60 than they did at 20, just like your skin, hair, and body change over time. That's not a failure or something to be ashamed of. But by understanding the real mechanisms behind tooth yellowing, you can take targeted steps to slow the process, protect your remaining enamel, and if you choose to, reverse some of the discoloration through whitening treatments. The key takeaway is this. Your teeth turn yellow with age primarily because your enamel thins and your dentin darkens, not just because of coffee and poor brushing. Armed with this knowledge, you can make informed decisions about how to care for your teeth, what products to use, and when it might be time to talk to a dental professional about whitening options. Your smile has been with you your whole life. With the right care and attention, you can keep it bright and healthy for many more years to come.